Welcome to this video about access arrangements. What are access arrangements? Access arrangements or exam concessions are special arrangements that can be applied for and allow candidates with special educational needs, disabilities, or temporary injuries to access public examinations. Access arrangements are reasonable adjustments as defined by the Equality Act and are specific to the individual candidate. They enable a level playing field to be provided by overcoming a potential substantial disadvantage when they are applied. They must not provide an unfair advantage, and hence applications must be based upon a rigorous evaluation of need and are heavily regulated by the Joint Council for Qualifications, JCQ, and the exam boards. Who is eligible for access arrangements? Anyone with a special educational need or disability may be eligible for access arrangements in public exams. They can also be considered for candidates with a temporary injury. Access arrangements must be based upon identified need and normal ways of working. For instance, if a candidate normally has a break after 30 minutes in lessons because they have concentration difficulties, this is their normal way of working, and an application for a supervised rest break can be made based upon need. Each application must be considered carefully and individually and may vary from exam to exam. Can a candidate have an exam concession without a diagnosis? The short answer is yes. A candidate does not necessarily have to have a diagnosed learning difficulty to be allowed an access arrangement. However, there must be evidence of need and normal ways of working, in addition to other criteria. Access arrangements are intended to increase access to exams, but cannot be granted where they will directly affect performance in the skills that are the focus of the test. What are the most common types of need for an access arrangement? Most applications for access arrangements are for candidates who experience difficulties in areas such as slow and/or inaccurate reading, maintaining attention and/or concentration, very slow and/or illegible handwriting, weak memory, speech and language difficulties, visual perception and/or visual tracking, visual impairment or hearing impairment, a slow rate of working, and anxiety. What is the difference between an access arrangement and special consideration? Special consideration is an adjustment to a candidate's mark or grade to reflect temporary illness, injury, or other indisposition at the time of the assessment. It may be applied for a candidate if the centre has failed to put permitted access arrangements into place during the exam series. It can also be provided when all the correct procedures have been followed and it's clear that the candidate was eligible for arrangements at the time of the exam. Access arrangements are alterations or adjustments to the delivery of the external exams themselves, based upon evidence of need. What are the most common types of access arrangements? There are a number of different arrangements which can be made according to the individual needs of the candidate. All applications must be personalised to the individual and based upon a rigorous evaluation of need through specialist assessments by the appropriate professional. The most common types of access arrangements are extra time, separate invigilation or small group room, word processor or laptop, reading pen, human or computer reader, supervised rest breaks, prompt, modified papers, coloured overlays, and human scribe or voice-activated software. This is the end of this video. You can view more videos on this channel in the Bite Size series, including other bite-sized reasonable adjustments videos.